Good morning. Hello. Thank you for the invitation to present DACIDO and our solution towards empowering and providing a solution for each individuals towards a healthier lifestyle. Let me start by taking a picture of you because I always like to have a picture of the public, and then I start. Thank you. All right. So in the next 20 minutes, I would like to give you our perspective on our experience in the last 4 years of building DACIDO. We're a Swiss-based company. I'll tell you a bit more about it at the very end. First, give you some insights on the market as we see it, the potential and what the dynamics are there, to then move towards building and empowering individuals in their own health and well-being, and then also share some insights and learnings of this roller coaster ride in the past 4 years. I understand we have some questions, space for questions at the end, so if you can wait until there or interrupt me during the speech. I like to start with this slide because it represents well where Europe is standing. Actually, it's not a picture from the US. It's pretty much everywhere at the moment or at this time. Inactivity by now is a bigger killer than smoking, and that's quite dramatic. So the question is then, why is that? So we obviously all know the sedentary lifestyles, which is affecting our health and well-being. But the thing is, the information is there. I think we all know we should eat healthy, we should move more, we shouldn't smoke, and we should drink moderately. But the data clearly shows it's not happening. So we know information doesn't change behavior, and that's a big problem. So the whole bet, if you will, with the digital health or mobile health, but also combining with other elements is well summarized in this quote from Ernst & Young from 2013. It's actually to try to touch the individual in the emotion in a relevant way, contextual way, so in order to facilitate this behavioral change. And we try to do that by combining a few things. On the one side, it's technology, algorithms and mobile technology, which you have with you, combined with the fun pieces, playful elements, so gamification features, features which are well known for online games, which I will come to a bit later. Also with social and collaborative features to make this a social experience, an engaging experience. You're not alone in that. And then, of course, adding intelligence through the fact that we exactly know what you do and what you track and what your behaviors are to provide personal feedback back to you. This is not an easy task. It's several elements, and try to find the right mix in that has a lot of power, but it's also a new science and there's no right or wrong, so it's also a lot of innovation through iteration. You get better at it with more people on it and with more insights from the data. So the market estimations grow and grow and grow on how big this whole digital opportunity will become, and I'll give you my personal perspective at the end of it. But clearly, if markets who are estimated to grow 30 to 40% over the next 5-6 years, something big will happen, and it's not going to be avoidable and will affect all of us because it will create change and trigger change. Now, it's not only the digital or the mobile markets. From our perspective, there's several different things merging together into this opportunity. On the one side, of course, you have healthcare industry, the largest in the world, mainly analog, moving towards digital. But you also have the gaming industry, which since many years is an established industry. It's bigger than Hollywood today, where it's absolutely well known and established how you bring people easily on board, how you keep them in, how you give them the shoulder pat, well done, the feedback, how you make them progress. All this is well known and is applied more and more in education or in other fields outside of gaming, like healthcare, and that's why it's called gamification. Then the whole mobility, so it's gone really fast. So when we started with let's say a web-based solution who also had an app where you could track. That was the big thing at the time. And in that time, the whole mobility access increased dramatically. So people expect more and more from a usability standpoint to be able to have access to all services on their mobile wireless device. That has certain changes in requirements to website design, to mobile app design, native design, like adaptive design, etc. Also, social networking, good or bad, it has completely changed how people deal with data, what they want to share, what they don't want to share, data privacy, all these points, and we need to work with that. And then there's obviously all the wearables, the explosion in wearables, which brings a lot of awareness into the topic. So you have all big brands going in, which is a good thing, because it moves it away from the geek status, from the quantified selves, towards the early mass market with the Apple Watch, with the Samsung Gears, Gear S, etc., coming to the market and creating a lot of awareness, and a lot is being written about taking ownership and healthy lifestyle. Why do I mention all these different things? What has changed is that today you have suddenly access to data you didn't have access to in an easy way some years ago. You're suddenly overflown with data about yourself, be this fitness related, be this health related, and most of us cannot deal with it. It's too much. So LDL, HDL, many of us don't know what that means. So you need something which translates that data in an easy way and visualizes and gives it back to you. A bit like a lifestyle navigation system. You know, the car navigation system today brings you from A to B in a safe way. And think about it like a lifestyle navigation system which helps you deal with your health and well-being. Clearly, Obamacare in the US and the EU Horizon 2020, they all want to leverage the value and the potential of the digital health. And this is clearly, you will see from market to market, the dynamics are very different for the adoption of digital health. But these trends are super helpful. Now, in the past years, many players have entered the market, and it's now easier to a bit segment, very simplistically, the value chain. So on the very left side, you have the tracker companies. So it started traditionally with Garmin Polar on the watches. Then came the free apps, who did exactly the same for free or for an upsell model, like Runtastic or Endomondo or Runkeeper, etc. And then more and more it got to wearables, move away from active tracking, where you still had to click start and stop, to passive tracking. You don't do anything anymore, and it tracks your lifestyle. But the game there, all the big brands are coming in, LG, Sony, Apple, Samsung, name them all, and it's going to be a business model based on selling the devices or the tracking. Then you have the data silos coming more and more, all the big players, it's going to be a game between them. You have the health kit, Apple wants to play in health and fitness, then there's Google Fit, who wants to play in fitness only, the Samsung Sami, which is also health and fitness. You will have Philips with Salesforce.com, it's more in the chronic care, and this will be a game for the big games. For players like us, who are pure software play, this is actually going to be a helpful trend, because then you have some APIs to connect to, which gives you access to hundreds or thousands of applications or devices. Because today, if I want to be interoperable, to be able to connect with other tracking devices, for convenience of the user, I need to go and create connections and API connections with every one of them. All right, enough of the market. We wanted to build something, a tool to help you track your life, and as a supporting and motivational piece to help you in your day-to-day towards a healthier lifestyle. Health is always transparent and difficult to grasp, so we wanted to change that. Conceptually, we said, if you cannot measure something, you cannot work with it. So we said we need to start by measuring health and wellness. Make this transparent and tangible, because when you do that, you can start to work with this, to retrieve an intelligence out of it. We chose an index from 1 to 1,000, but it could be age related, it could be something else. But basically at Takedo, from 1 to 1,000, 1,000 you're Superman, 1 you're basically clinically dead. That was our measure. But what's the logic? It's 200 years ago, you would also describe temperature. You would say it's ice cold, or it's boiling hot, or it's room temperature. and then came Celsius or Fahrenheit, and then you were able to very clearly define what the temperatures are. Same we want to do with the health score. Conceptually, we attached it to the Da Vinci Vitruvian model, the man in the circle, you might remember, who 500 years ago defined health as being who you were, your body metrics, what was brought to you, how you feel, what's your mental health, and how you live your life. What is your lifestyle? What do you do with exercise, nutrition, alcohol consumption, smoking, etc. So the score is based on 3 pillars. So why do we think this is really interesting? Because as an individual, when you enter, because it's based on a big underlying engine, with a very few data points, we give something back to you. Today, forget that people will give you a half an hour to fill in questionnaires. They don't do that anymore. It's boring, and the attention span on the internet is very short. Especially on personal data, they will not give you. They will enter fake data sometimes. So you have 2 minutes. That's the attention you have. You have to sign them up, and you want to give something back. Because on the internet, it's a something for something economy. So you give something, but you want something back. So you give 4 data points, you get immediately a score, a range. And then you're not obliged to give more. Then you can start to play, to dakadoo. You can make friends, you can get social, you can participate, you can start tracking, whatever it is. And with time, we nudge you, we motivate you to give more of yourself. And the score will become more complete and more personal, customized to you. As a company in the organizational world, if you have obviously the risk group between 30 and 60 are all working. So for companies, having a consolidated score of all their employees or those who participate is interesting, because then they have their ROI measure over time and see the evolution, a bit like a stock quote, moving in real time all the time. Now, clearly, a score is not the answer for everything. In that room, I might maybe excite 10% of you, I admit, because it's probably those who are more analytical thinking or those who are organized and like to write things down. But the majority of us needs more, needs some tickling in the right way. And the tickling part is a complex part, because everyone reacts differently to gaming features, to social features. So you need to build something which is large enough that I can cover enough of you to make it attractive for enough of you. I cannot cover everyone, I know that. But if you make it attractive to many, then that is helpful. So that's why we integrated systematically gamification features to make this a fun experience. Health should be fun and engaging and not something sad or bad, invertedly how sick you are. We want to tell you how good you are, how healthy you are. And the social features. So you can enter groups, you can make friends, you can comment live on what the others do, you can spy on what they do, of course, if they allow you to. In the sharing. But we call this the ref factor. All these features we regularly evaluate, and that's often brutal, because sometimes we launch something into the platform and then there's no reaction or abysmal reaction from the users. Then we have to take it back. That sometimes hurts. But the thing is, it has to be relevant. It has to be easy, immediately, no long explanations, and it has to be fun. There has to be a certain fun factor. So if they typically score well on all those 3 elements, then it's a killer feature. But if not, we have to think about it or rework it. Another point you need to think of is the interoperability. Oh, difficult word, I never know it. Interoperability, now I got it. The thing is, we're in year 4 of tracking, or 5 of tracking. People have, by now, many of you have own tracking devices, consumer devices, or have in their cloud some data because they jog with an app, or they have a Garmin, or whatever they have. So they don't want to start all at 0 again. That's really annoying from a consumer, from a usability perspective. So you need to make this connectable so that you can easily transfer, if you request the transfer as a user, the data onto the platform, and then we can work with that data. Because typically, all the tracking companies I showed you, they track, and they're really good at it. Some are bad, but many are good in tracking and showing all the track points, but they don't do anything with the data. We then use the data to calculate the health score and give you the whole picture in a more holistic way of your health and wellness. Obviously, the evolution, and it's very present in the media, moves on to the smart watch, which is interesting. Technologically, it's still complex because of the battery issue, because you don't have independent devices. Samsung has been first there, because they do have the ability to have a completely independent device with the Gear S. But this will come. They will resolve the battery problem. And then you have the extension to the hand, which is practical, because you can have the coaching functions and all these things on the hand and have better interaction on the go. For the engagement piece, that's a good thing. So where are we today? We have this a solution built which has its applications and web as well, of course. Speak 6 languages and are live since 2011. To the consumer, the first time we went live in 2013 in the UK with our partner. But that's not the end of it. This is a continuous effort. This is really a journey, and we continuously continue to build and improve. So right now we're in the middle of building version 3.0, where we basically rebuilt the whole engine at the back end from scratch. Because after 3.5 years of coding and building a thing, sometimes you need to scrap it all and build it all again with all the learnings you get from the data gained and all the complexity of the coding. So that's what we did with version 3.0, and by that also responded to an increasing requirement in the market, which is to have a unified API where partners who also might already have some solution in the market might dock and connect in the backend and just take a couple of services of what we do and build their own apps on top of it. Because more and more you want to adjust your user journey typically to what your offering is, and not just copy-paste our user journey. Several companies will still use exactly our user journey of the application and the web, but many might choose an adapted version of it by just connecting to the backend. Mobility, mobile apps will be a very important topic. So when you move, like us, from a web-based service to a mobile-first strategy, it has some challenges to overcome, because you add more and more services and functions to the app, which doesn't make the navigation easier because you have less screen size. So you need to make very hard choices on what to show, what not to show, and how to navigate in an easy way. And we as well struggle through that process, and I think with version 3.0 we're a good step further. How do we make money? So we have a very clear B2B and B2B2C strategy, and that's all we do. You have a B2C access, so you can sign up and test Akadu for 30 days, but that's not how we build the business. It's B2B, we go towards payers. So we go towards employers, so that they use it for their employees, or towards insurance companies, so that insurances can offer this to their insured, like a fitness abo, or other ways in the future. And then some key industries we defined where there's a clear value proposition, so fitness wellness chains, mobile telcos, because the mobile health opportunity is huge for telcos. As you know, their growth rates are decreasing significantly, and then media organizations, because they write about all this content of beauty, wellness, etc., but for free. So they desperately look for models which could be fee-based for the future. Because we're B2B, our solutions can be fully branded, completely branded with your own apps in the store, in your own name. This is how we're in the market in the UK with Nuffield Health and other markets as well. So what is our learning to close up the presentation? First, I showed you this slide in the beginning. That's what analysts and consultants say. But we're in this since 2010. So it's going to come. But that doesn't mean that it's all exploding at the same time in every market. This is more what we see. We clearly see companies move, because we're B2B, companies moving from a RFI, a request for information, or let's look at this, let's make a study, how will this affect our business in the future, an evaluation phase towards a more project and go phase. I think we're now moving into that direction, but it clearly depends on each market. Not every market is ready. To give an example on the corporate wellness market, clearly the US as a big trigger point, because employers pay the health insurance of employees, so the pain point is in their books. If the health costs are bigger than the operational costs for a company, that's a big issue for a company. So they need to make sure that their employees stay healthy for a longer time. So tools like hours that can help to maintain this population healthier over a long period of time are interesting. And Obamacare incentivizes outcome-based incentives for employees significantly with Obamacare since 2014. But not all markets are like this. Switzerland, everyone pays his own health insurance, and many companies think, oh, well, that's private, they should deal with it themselves. So there's a completely different dynamic, and that is really from market to market. Then define your offering well, because if you click health or fitness in an app store, it's really scary. It's confusing for the user, because there's so many apps and brands and solutions in the market that it's really difficult for a consumer to understand what is your thing. So what do you do? And okay. And so you need really to define your offering well. So for instance, if we look at just what we do, how many look at it holistically? Because to do a fitness tracking app, that's easy by now. Many do that well. But to combine dots and look at stress, nutrition, sleep, exercise, your mental well-being, etc., that's more difficult. And using indexes for that, that's also more difficult. So in Europe, actually, we're one company. Now, also select well your strategy. It's also been a constant struggle with us. We always said B2B, but in the very beginning, it was very difficult because we were always being compared with B2C solutions, with investors or with who else, journalists, everyone who had an interest in what we were doing. And we were focused on finding partners to launch, but when you say, well, we haven't launched yet and we have like 3,000-4,000 users, they would like look at you, well, but that app has 100,000 users. But then again, we did more turnover than many of these apps with less revenue, with less users, because we ask for fee-based solutions. So it might take longer to get access there, but once you have access, you get access to much larger volume than you ever be able to do by growing it organically with your own funds. Unless you're first in something and it becomes viral and grows. Then B2B or B2C, and that's the key, that's an important message, for adoption, to bring you on and to engage, to keep you in, is so important. So at the end of the day, even if you're B2B, it needs to be completely easy and usable, user-friendly, because you're always going to be compared to what users are used to use, an Apple iPhone, a Samsung device, or whatever the device is, or the solutions they are. This is really, really important. For us, also a learning journey. We started as a web-based. We were so happy and proud in 2011, and we explained everything. We had pop-up texts. We had lots of graphs and stuff like this. Nobody understood a thing. So then we had to learn through the first launch to consumers. We had within 3 months access to 30,000 users, and that was like an awakening call. And then we had to work a lot on usability. So text went out, pictures came in, simplification. And this is an ongoing journey, and this will never stop, because user patterns also change with all these introductions by consumer electronics and players. That behavior also changes on how you use and how you navigate in things. So you need to keep track on that all the time. Then that's also a big learning. We're a solution which uses a lot of scientific data for the tools we use. So we really take a lot of emphasis on that. We have a scientific board who approves what we launch, etc. And that's very different from an Azumio app who claims to have a stress tracker by infrared, putting the finger on, which every scientist will tell you that's absolutely impossible to measure stress with putting your finger on through infrared. But science and usability often is a difficult one. Because I give you an example, we have a quality of life questionnaire, which is based on the SF36, the WHO, and the CDC quality of life questionnaires, which have been tested with 4,000 people, which have been launched to the market, which the questionnaire is super, it's great, but it's 27 questions. And now from the behavior of users, we saw, okay, people do it exactly once, or maybe twice, but not as frequently as we would like them to do that, to have an updated status of their mental health and well-being. So the learning was that we tested now to divide this into little pieces and to feeding them every couple of days with 1-2 questions on their status. And that people do answer. And we test that extensively for 8 months, and now launching with version 3.0 a different way on bringing this to the user. And these are learnings you cannot do on paper. You have to have users who test that, who do that, and who use it. Only then you realize things like that. And that's why science is super important, because it gives you credibility, but you need to find the right balance between science and usability. And I'm at the end. Quick word to Dakedu. So we launched in 2010 with currently 23 people, mainly developers still. Headquartered in Switzerland. We do all the back-end development in Zurich, API and the logics databases in Zurich. All the front ends, all what you see, the mobile clients and the web clients, we do in Kiev, in the Ukraine. The health score, we have several patents granted already in the US, Russia, and Europe. For that already, we started in the Anglophone regions and moved now towards the German and Francophone regions. And we've been able to gain some good recognitions. Thank you very much, and I'm open for questions now.